So today we're going to do a session about supporting carers in the workplace. And I think with sessions like this, they do tend to bring up a lot of kind of personal experience. A lot of people start to think, actually, I am a carer in the workplace. So we're going to work through the slides today and share experiences. And there's a tiny bit of discussion as well. Okay. So just a bit of an introduction. I'm Gabrielle Borro. I'm the Joint Carers and Engagement Lead at Coventry City Council. So my role is around the practice that we have within adult social care. So making sure that we support carers well through the process of accessing adult social care. So things like carers assessments, and also the support that we provide for carers from our external full sector organisations. And I'll introduce Anna.
Hello, so my name is Anna Luczyna and I'm the Working Carers Development Officer for Carers Trust Heart of England. We are a charity that supports unpaid carers in Coventry and Warwickshire.
Fantastic. So just sometimes I always think it's so today's session will cover the importance of supporting carers in the workplace, what a caring journey might look like, what are the local authorities' responsibilities towards carers, the new carers leave regulations which came into effect last week, an overview of services provided by the Carers Trust, and how you can develop your approach towards carers. And we are able to provide a toolkit of resources to any establishment that needs some support. So just without further ado, I think it is always helpful, I think, to introduce the definition of a carer. So we're not talking about paid staff today. We're not talking about people that are in paid employment or voluntary opportunities. We're talking about people that have taken on caring responsibilities for a loved one, friend or neighbour that has an illness, a long-term condition. It might be a substance misuse disorder, or it might be somebody that needs support as they grow older. We have about 100,000 carers across Coventry and Warwickshire. We think kind of it's very difficult to know the exact amount of carers, and we base it kind of quite heavily on census information. But the economic impact of people providing care across the both organisations, you can see, is absolutely enormous. So we think in Coventry, carers save us about £680 million per year, which is just enormous. And that was a figure from 2015. So if we think of kind of inflationary rises and things like that, it will be significantly more now in terms of that contribution. And that's things like people avoiding hospital admissions, the kind of care that people receive day to day. It kind of exceeds the amount that the local authority pay towards care and the NHS. So I just thought maybe within the chat, if people wanted to say what they think are the main experiences that carers experience within the workplace. Anybody wants to start, be brave. Yeah, work-life balance. Yeah, really difficult. Yeah, you might be going straight home to a caring responsibility. Yeah, balancing workload and caring. Yeah, not being able to get the right time off, that's a significant thing. Yeah, stress. Needing to take time off unexpectedly, that's absolutely huge. Yeah. I think we can all feel really kind of start to feel quite inconsistent, can't we, in our approach sometimes, and that we're maybe letting people down. Yeah, managing to keep productive when worrying about, yeah, definitely. So you're kind of going to work with lots of worries on your shoulders. Yeah. Finances. Yeah, huge thing. Worry about kind of finances. Yeah. Yeah, frowned upon for taking time off. So that perception that we might feel quite of that additional scrutiny as well. Yeah. Yeah. And it might be that we feel there's some inconsistency as well within the workplace. So maybe someone with similar caring responsibilities is treated in a different way. Yeah. Yeah. Okay, so as we can see, we've probably all maybe got some personal experience as well as experience of supporting staff. Yeah, made you feel like you're blagging and just trying to get extra time off for no reason. Yeah, it can feel that way, can't it? Yeah. Okay. So, with regards to supporting carers in the workplace, it's not just a necessary, it's not something nice to do. We think it's absolutely essential in any workplace that people with caring responsibilities are supported. And that's because the statistics are, a huge proportion of a workforce have caring responsibilities. There's absolutely no doubt about that. And if they don't have caring responsibilities now, throughout your working career, you are likely to take on some caring responsibilities whilst at work, because it is the peak time for caring is during working life. So we know that people generally take on caring responsibilities for parents, during a working life career, but it may be what well be for children as well with extra needs. So we know that during our working lives, most of us are going to have some experience of being a carer. So no caring journey is the same, and I think that can be really difficult for people to process. So it may well be that you kind of have those kind of that fight back. Someone says, "Oh, well, when my dad had dementia, I was able to manage." No caring journey is the same, and the level of support we have with a caring journey can differ. So whether we're in a network, whether we've got support around us, we might not live near friends and family. So there's can be lots of different factors that can impact a caring journey. It may well be that caring started suddenly after a sudden illness or a disability, but generally caring roles build up over time quite incrementally, and we tend not to see ourselves as carers. And particularly when we start off with things, maybe just doing kind of, oh, I'm just going to go and pop in on mum today. And then it might become more intense, or I'm going there every day after work. I'm there until she goes to bed. It can increase over time, and we're very unlikely to recognise ourselves as a carer during that time. Um, so caring is a very different experience for everyone, but key to that is identifying as a carer. And what lots of people tell us that are caring is they don't recognise themselves as a carer. They are mum, dad, son, daughter, grandparent, granddad. They're all those different relationships. They're not necessarily a carer. But the reason why identifying a carer is so important is because it means that you then can access the right support, and there is multiple support mechanisms available for carers. So we know some carers become carers overnight, and that might be a sudden illness, say for instance a stroke, a heart attack. It might be an accident, or it might be just a sudden change of circumstance. So, for example, the person that was usually caring for somebody is no longer able to do that, and you might have had to step up in that position. But for the vast majority of us, it is that kind of slow, steady kind of change in the dynamic of a relationship. In the UK, we think there's probably 1.4 million people with this was during the pandemic. We thought 4.5 people became carers overnight in March 2020. And we still see the impact of the pandemic on carers. So we still feel there was an enormous impact on people with caring responsibilities during the pandemic. Anna, I'll let you do this one.
So some key facts about working carers. So we know there are around 5 million people in the UK at the moment who are actually combining caring for a loved one with paid work. And that equals to around 1 in 7 workers, and which is a massive amount, isn't it? And out of those, 1 in 4 have actually considered giving up their jobs entirely because of how stressful it is sometimes to combine their caring role with their job. And like Gabby mentioned before, the peak age of caring actually often coincides with the peak of someone's career, around their mid 40s to their 60s. So if people at the peak of their career start giving up their jobs, we know that for organizations, it means that they will lose those key experienced employees, and that will mean that they have to invest in the recruitment and retraining costs as well. But actually, there's a quite simple solution to this, because 89% of carers say that the most important support that they can have in the workplace is an understanding employer. So that can make a massive difference to them. Thank you. So that's why supporting carers makes business sense for organizations, because it can help you attract and retain existing staff as well. It reduces your recruitment and training costs if you can keep those experienced employees within your organization. It can help reduce stress, sick leave, and absenteeism. It helps to increase resilience and productivity as well, and improving people management and staff morale as a result.
Okay, so the local authority have significant responsibilities towards support we provide for carers, and those are both defined in the Care Act 2014 and the Children and Families Act as well. We have the responsibility to offer anyone with caring responsibilities a carers assessment. And a carers assessment is an ideal opportunity for anyone to come forward and talk about their caring role in kind of quite a holistic way. So we know that a lot of people who have caring responsibilities have perhaps talked a lot about the person that they care for. So they've had to maybe fill in forms, do a lot around the person that they're caring for, so maybe disability or illness, but they've never been given the opportunity to talk about the impact upon themselves. So a carer's assessment is a really good way of identifying any kind of needs that might arise from caring. And as a local authority, we have the responsibility to meet any unmet needs that might arise from caring. So it might be kind of an impact on that person's well-being, that's having kind of a significant impact on their day-to-day life. And we also have to look at what a carer is willing and able to do. So from an adult social care perspective, we have to ensure that carers are actually happy with their caring role, that they're able to maintain it, that they've got the skills and support to do that, and that's sustainable. So we see lots of carers that are in their kind of late 80s doing lots of manual handling, and it's things like that that are just so unsustainable in the long term. Or seeing carers with their own health needs, putting themselves through a huge amount of pressure of caring responsibilities. So as a local authority, we have to support carers and to make sure that any kind of unmet needs are supported. Um, and yes, I think a carers assessment is a really good way and a really good opportunity to kind of support people and start those initial conversations and act as a bit of a buffer for the right support. And Anna is one of many workers at the Carers Trust that undertake carers assessments. So yeah. Oh, gone past it. So we have quite lot of support for carers within the city, and I think it starts really with good information and advice. So making sure that people are aware of their rights, are aware of what benefits that they can apply for, and having some of those early conversations that are sometimes needed within a caring journey. So considering things like lasting power of attorney, what support is needed to plan for the future. And emergency planning is a really important one, and we'll go into that in a little bit more detail as we go along. And we could have, as kind of like we move through and needs increase, we've got things like carers assessments that can help, or it might be that the person that you're caring for needs an assessment of their own needs, and we sometimes call that a joint assessment if you're having it done as a carer. And then there's services like telecare, so that low-level equipment that can go into a household. It might be occupational therapy might be needed to look at some of the barriers physically that someone has to being able to meet their own needs. It might be something times that they need counselling, or it might be specialist services like we have an admiral nursing team that are specific for carers who are supporting somebody with advanced dementia. And then we've got kind of that more specialist support that people might need, which is things like residential respite, so having a break. It might be short breaks, so having like those a bit of support within the household to enable you to have a break, so to go out the house. Um, Carers are also eligible for direct payments in their own right. So it might be that you need something as a carer to support your own needs. So it might be something like we have paid for things like a carer to complete driving lessons because it really supported them. The inability to drive had really affected their caring role and their ability to get around. So it might be, a piece of equipment within the household. It might be that access to some counselling that's been identified as being needed, because caring is a hugely emotional undertaking, and it can have a huge impact on the emotional well-being of somebody. So
Um,
Anna's going to talk a little bit about the support within the workplace and what can be done within a workplace to support carers.
Yeah, so one thing that organizations can introduce to their workplace to support their working carers is a career passport scheme. So a career passport is essentially a record that identifies that someone is a carer and records the offer of support or services that is available to that employee. And all the resources can be downloaded for free from the Career Passport website, and they can be adjusted to match your organization's requirements.
And just to add to that, like a lot of workplaces do have kind of things like a reasonable adjustments passport and
Mm,
things like that, but they can be amended if you've got something already existing within your workplace, you can amend it. Just take some aspects of the carer's passport into
yeah,
that to make sure that it's applicable for a carer.
yeah. So a little bit more about the career passport scheme. So, like I said, it provides a straightforward way to document any flexibility and support that you agree on with your employee. It can be used as part of your one-to-one meetings with your manager, for example, and it just gives people creates a safe environment for them to even mention their caring role in the first place. Because we know from working with carers that a lot of people don't ever talk to anyone at work about the fact that they are a carer and they do have caring responsibilities outside of work. And by using a career passport, you just give them an opportunity to bring this topic up without feeling, maybe sometimes people feel a bit worried about mentioning it or even embarrassed. And in this way, when everyone in the organization has a chance to talk about the caring roles, this reduces that risk that people will just hide it and not mention it. And it also helps you communicate what existing workplace support you already have in your organizations, because we also know that a lot of carers are not aware of any sort of support that their organizations offer their working carers. And this gives you an opportunity to have that two-way conversation. So the carer can talk about what their needs are, and you can talk about what existing support already is already available in the workplace. Another way in which you can support your working carers is to conduct an employee survey. So that helps you gather information about your carers. So identifying carers, who they are, what their needs are. That they can tell you themselves what they think they would support them the most in the workplace. And this gives you a way of better understanding what challenges they're facing and how you can best support them. And we also included a sample survey that you can use at the end of the slides. We have a little toolkit for you as well.
So we undertook a survey within our workforce, and it was really kind of insightful, really, because it was really, sometimes when you undertake a survey, it can be really difficult to get
Mhm.
responses, but we found we didn't have to worry about getting responses. People had a lot to say about caring within the workplace. And I think it's because it's such a common thing that's happening, but actually it's not something we recognise really. We're more likely to recognise maybe that parent carer role, so having children and the impact that having children has, but we're less likely to maybe talk about, oh, like, I'm looking after my mum after work, or I'm having to go to all these hospital appointments and the impact that that's having. People shared to us really lots of different things and loads of insight into kind of what worked and what didn't, kind of what didn't work within the workplace, and what people found helpful. And things, the common things that came about were kind of working from home, good flexi provision, just an understanding manager, people kind of having an understanding of caring in general. We might have, there's some workplaces have a really good understanding of it, but they might not have that kind of practical support in place. Annual leave, obviously a big thing. Being organised, so people kind of saying that they really needed to be organised within a workplace. Um, and lots of kind of insight really in terms of what people were kind of offered to us in terms of their caring role.
Mm. Okay, so another way in which you can support your working carers is to either produce a specific carers policy or include carers in your existing policies as well. And that it's a good idea for it to include your definition, your organization's definition of what a carer is and what that means. And then details of any support that you offer to your carers, or maybe references to some other policies which would be relevant to working carers. And also details of what support is available to line managers so they can better deal with any challenges that might arise as a result of supporting working carers. And we also included a sample carers policy at the end of the slide, so you can have a look at that, and you can also use it to create your own. So some career support options that we found that work really well are flexible working practices. So a lot of people say that either working from home or hybrid working, or flexible hours, that really helps them in their caring role to manage those responsibilities at home and at work. Emergency leave. So if something happens to the person that they care for, there's maybe a breakdown in caring arrangements, being able to leave work to sort it out straight away, that really helps people to have that peace of mind that they can, if they have to, they can leave. Um, and then carers leave. So the law has changed a little bit last week, like Gabby mentioned, and she will talk a bit more about it in a minute as well. But carers leave can be paid or unpaid according to your organization. And then maybe starting a carers network, so a group of working carers that meet regularly, and then they can discuss what the challenges are in the organizations for working carers, what support would be helpful to them, and just to provide peer support to one another as well. And sometimes really simple practical solutions really help carers. So, for example, things like allowing them to park near to the entrance of the workplace, or allowing them to take personal phone calls to check on the person that they care for during work hours. That can make a massive difference to someone's well-being, and just give them the peace of mind. Okay, so carers trust services. So some things that we can do to support carers. One thing that we do is we work with the council to conduct carers assessments for people. So Gabby already talked a little bit about it. Carers assessment is just a conversation with the carer to look at their well-being, to look at their caring role, if there's anything in the caring role that's challenging for them, and what we can do to help, what we can put in place for them to support them. Uh, and it gives people an opportunity to talk about themselves for once. So people, the carers often tend to talk about the person that they care for all the time to doctors, to social workers. And our job is to really help them focus on themselves and their own needs and their own well-being for once. Another service that we have is the Carers Response Emergency Service, or the CREST service. And that provides, they can provide up to 72 hours of free care for people. Let's say if the carer becomes ill or they have to go to hospital and there's nobody else to look after the cared for person, then the CREST service provides that emergency care for up to 72 hours. We also do training for carers, so things like dementia training or moving and handling training to support them, so then if they have any doubts on how to best do their caring role. We run a lot of support groups for carers. So we have evening working carers support group. We also run support groups during the day, and we have a lot of one-off events as well. So things like flower arranging or meditation or yoga that are really popular with our carers as well. We can provide one-off direct payments for carers. So Gabby talked a little bit about it as well. We can do it as part of a carer's assessment if there's an identifying need for something that will support the carer's well-being or support them in their caring role. Then we can help them pay for the item that they need or whatever it is that they might need. And obviously, we can't help with everything, but when we can't help, then we can signpost you to other organizations that we work with that can support you with different things as well. We can also support your organization to develop a more personalized approach to your carers. So, if you have any doubts on how best to go around, for example, creating a carers policy, or you would like to have some training for your managers on how to support carers, or even just raising awareness of carers in your workplace, we could do that for you. We can support you with carer proofing your policies. And we also do in-house events or workshops for carers in the workplaces where we can even conduct carers assessments on the spot if needed. So just get in touch with us and I'm sure we can work something out together. We have a lot of resources for our carers as well. We have a specific booklet specific for working carers that has some information about people's rights at work, how to speak to your employer about your caring role, because we know a lot of people are quite worried about having that initial conversation, how to look after yourself as well, and how to access wider support in the community. Gabby, you're muted.
Yeah, I just saw the little thing pop up to say I was muted. Um, so we've put together a bit of a toolkit for people because it's really hard to know where to start when you're thinking of kind of carer proofing and making sure that the workplace is carer friendly. But there are some real quick wins, and actually, having done it within the council, it's been a really like enjoyable activity, really, because we've seen the benefit of it. And there's a few things that you can do quite quickly to improve things for carers. We have a free online training called Carer Aware, and it is like a very low level training. So it's basically to try and help people understand who is a carer, what like the difficulties might be within just in general. And we also have a young carer aware as well. So obviously it probably wouldn't apply so much to people within the workplace, but it is good to be aware of young carers as well. Anyone can access that free of charge. I think Jenny's also asked in the chat about the cost of events or workshops in the workplace and that they are free, aren't they, Anna?
Yes, they are. So we are a charity, so anything we do to support carers, we can do it for free. So if you would like us to come to your organizations, then yeah, we do that for free. You don't ever have to pay for that.
There's a sample survey. So as we said, we'd done a survey within Coventry City Council, which we're happy to share with anyone that wants to use it. As we said, it was really insightful as to kind of the experience of people within the workplace, but it also was quite enlightening as to kind of some of the intensity of caring roles that people were managing alongside working. The Carers Trust have got a balancing work and care booklet.
So yeah, so that's the booklet that I just mentioned. That's for working carers specifically, and it has information about their rights at work, how to speak to their employer, how to look after themselves. This can be downloaded for free from our website, and we will also include it with the slides, won't we? And then we have the carer passport. I already mentioned it in the presentation. You can download all the resources for free as well from the carer passport website. But we just included the carer passport log, so the actual passport in there, so you can have a look at what sort of information is in there, what it involves. And then we have the welcome pack from Carers Trust Heart of England that has an overview of all the services that I mentioned earlier, and our contact information so everyone knows how to contact us. This can be distributed to your working carers as well, so they can get in touch with us individually if they need to.
Yeah. We've got the carers e-bulletin that can be sent out. It's sent out on a monthly basis. So we would advise anyone to subscribe to that for either a professional or a carer themselves. And that gives you basically an update of everything that's going on within the city to support carers on a monthly basis. So it has timetables in there. We put any kind of relevant evidence or research that might have come about. We also just promote any groups or activities.
Mhm.
And there's stuff about new legislation and new policy, and maybe sometimes there are national campaigns as well that happen, like the State of Caring survey as well. So there's some national campaigning done around carers.
And then we also included a career-friendly employer checklist. So that's just a one-page document with all the main bits that are important to including your organization to support your working carers, and a sample carers policy that you can adjust and use as your own policy, or you can use just bits from it in your existing policies as well.
Just before we move on, someone's asked about the service being available outside of Coventry and Warwickshire. We do commission the project around working carer support, so it is within Coventry, and do you do some work in outside of Warwickshire as well?
So we have two separate teams, one for Coventry and one for Warwickshire. I work for the Coventry team, but we have specialists in the Warwickshire team as well, and we can work together if needed. So if anyone from Warwickshire needs any support, then just get in touch with us as well.
It is within Coventry and Warwickshire, but what I would say, Tracy, is that there are some every local authority has their own uh, carers organisation, and most have something to do with employment. I don't know whether it looks the same as ours, but it's definitely worth inquiring with your local organisation about what they can offer carers within the workplace.
Yeah.
We think it's so beneficial to work with workplaces because, as we say, identification is really important, and we know that lots of people have caring and working responsibilities. So I'm sure other organisations have similar projects in place. Yes, it's not, sorry, it's not a whole West Midlands approach, but we, as I say, it may well be other organisations. Solihull's got Carers Trust as well.
Yeah.
Birmingham, I think, have got forward carers. So there's lots of different kind of provision in different areas.
And all the documents that we used here can be used anywhere, can't they? Because they're universal. So
Yeah.
yeah.
We just wanted to do a little bit of an update about carers leave regulations, and it really is the first time that legislative change has happened for carers within the workplace, and it came into effect last week. So it is quite timely that we've had this webinar and able to talk about it. But as of the 6th of April, employees will be entitled to up to 1 week of unpaid leave to give or arrange care for a dependent. They don't have to be a family member, and you don't need to prove that you're caring for somebody. It relies on kind of the trust and the partnership between who you're working with. And it can be anyone who relies on them for care. So we're not this isn't about children, although there were some changes that happened wider, but this is about people that rely on you for care. So it might be that they have a physical or mental illness or an injury that means they're expected to need more care for more than 3 months. They've used the definition of disability from the Equality Act, and care. Oh yeah, so care need because of their old age as well. Key changes are it's a day one right, so you're entitled to this right from day one of starting at an organisation. and employers will not be required to provide any evidence, as we've just said,
Mm-hmm.
or explain how the leave will be used. So you shouldn't be finding, or you shouldn't be interrogating people as to kind of what they're doing with that time. It is up to 1 week of unpaid carers leave, and I did have somebody ask about multiple caring roles, and when I looked through the legislation, it's very clear that it's only up to 1 week. So if you have multiple caring roles, you can't say, for instance, take 6 weeks off because you're caring for 6 different people. And unpaid leave can be taken from a half day or a day up to and including 1 week of leave. So it's but I think organisations probably have to build in a mechanism as to how they count that and capture that moving forward. So that's a really positive change. It is a recognition. We'll kind of always strive to that exemplar, which is paid leave, really. But we know that's not an option for all organisations. And then the other big thing that you can do is just use opportunities to talk about caring within the workplace. So there are 2 big things that happen for carers throughout the year, and then there are some stuff about young carers as well. So we have Carers Right to Stay, which is usually towards the end of November, and that's always a really good opportunity to talk about the rights within the workplace, the support that's available, promote any kind of documents or guidance that might be available within your workplace, and get the conversation started about caring in a workforce. And then there's Carers Week as well. So that is this year's second week of June. Usually at the same time every year. And we have a whole programme of activities of things that are going on within the community, so lots of events and opportunities, and it may well be that you want to support carers in attending some of those and maybe giving people the space to go to things during that week as well. So but your organisation might want to do something to promote Carers Week as well. Jenny's just asked a question in the chat, which is, although evidence around carers is not required in Thrive until silver level, we highly we highly recommend we get this in place as soon as possible. And then just in Coventry, this is just Coventry specific, but as we say, quite a lot of the same schemes and support exist. Any carer is eligible for Go CV Plus cards. So if they register with the Carers Trust, they can get support to discounted rates, and sometimes free as well, if they register for a Go CV card. And the other thing that we really encourage is that a carer tells their GP, and this is really important from an employment side of things as well, that they are a carer, because GPs don't routinely ask that question, but they do have a performance indicator, so they can register somebody as a carer within the practice. And what it means is that carer then is recognised if, say, for instance, there's kind of a seasonal flu vaccine, they'll be prioritised for that. Say if there's a COVID booster, they'll be prioritised for that. But also it may mean that they might be given more favourable appointment times, or there might be a bit more discretion about how they're supported. So there are a few little things out there to support carers, just as a little bit of an add-on as well.
The point I'd really like to make is around the fact that a lot of time people don't realise that they are carers. I know I was a carer because I did care for my father when he was terminally ill for the last few months of his life. However, I worked with a colleague who she didn't actually have it was her father-in-law. She didn't have him live with her. He was in like sheltered accommodation. However, she used to go every other day. She would go and pick up his washing, do his washing and ironing, take it back. She'd go at the weekends and do his shopping. It's things that you don't think of. You just think that, well, I'm doing that because it's her husband's dad, but actually that does take a toll, because she's having to take up her own time that she might have been looking after her own family, because she got two children. They weren't particularly young, but they were still kids living at home, you know, and a full-time job, you know. So it's being able to recognise, because people often don't recognise in themselves that they're a carer, and obviously the things that are going on, you know, that they're worrying about when they come into the workplace. And I'm pleased to see about the carers leave. I know it's unpaid, but I'm pleased to see that, because again, I wasn't their carer. Well, I didn't consider myself their carer, but my elderly neighbours, they were both in their 80s. In the last, well, in the last 6 months, used to come to me and, you know, ask me if I would take them to the doctors or things like that, because they knew I was working from home. And, you know, it came to the point where, you know, I was getting to the point where I was going to have to say, look, I can't, because I'm busy, I'm doing my work, you know. I mean, I did take them on a couple of occasions because they had nobody else and they were both in their 80s. And it's times like that where you think, if I could have taken that unpaid leave, then I could have taken that time without feeling guilty that, you know, I'm leaving my work to nip out to take them to the doctors to come back and carry on. I mean, fortunately, I work for the council, I can work flexi, but, you know, if I was in a different situation, it might be more difficult. I mean, sadly, they both passed away now, but it's about, I think the survey and understanding and having conversations with people to find out what is going on is really important, isn't it?
Yeah, definitely. And you know, we all know, don't we, that different workplaces have really different ways of working. So, and the impact maybe of you being off maybe is more significant in certain workplaces, depending on what your role is and things like that. So obviously it's got to be, the kind of policy in place has to be appropriate to your own workplace. But yeah, I would say that identification is the biggest barrier we experience, and it isn't just, I think a lot of people see it as practical support. So I'm practically doing this for mum or dad, or I'm practically doing this for my husband, but actually it can be the emotional impact as well as looking after somebody. So say for instance, you're supporting somebody with a mental health issue and they're ringing you, you know, throughout your working day, and you're constantly taking phone calls and having to provide a lot of reassurance and a lot of guidance. That equally is a caring role. So it's not just seeing it as kind of rigidly defined as, oh, I do personal care for mum and dad. It is seeing it as that kind of wider caring responsibility, and we've got that really quite wide understanding of it. And things like substance misuse as well. So maybe you're looking after somebody with alcoholism or, you know, like maybe drug use. That can be an area where people never recognise themselves as a carer because they don't see, maybe there's a bit of stigma attached to it as well, but actually you are probably providing a lot of emotional support, so you're probably having to put lots of contingencies in place. That equally is a caring role. So it's just thinking a bit more broader about that, the word carer, and we don't think it's always that helpful, the word carer, but we do know that it is the word that's used. It's the carer's allowance, it's the everything, it's the word that's used to help people get support. So we do use it still, but it might be more helpful to use language within the workplace that's things like, do you have caring responsibilities? Do you look after somebody? Rather than using the word carer to try and engage people and get people involved. Yeah. We got another chat question. Howard. I think, Laura, with your question, I think it's just having that honest conversation with your employer that you are a carer, or you're taking on some caring responsibilities. I think it does start with that discussion with your manager. If you don't have to tell your manager that you have caring responsibilities at all. And we did find when we did the survey that a lot of people said, I haven't told my manager. But a lot of people told us that they had told their manager, and their manager, as a result of that, been quite supportive, and had made kind of changes. And surprisingly, a lot of people told us their carer could relate as well. So, and had caring responsibilities too. So there's no kind of like formal, you wouldn't need to go HR in the to say, oh, I'm a carer. I think it's more just kind of having that open, transparent conversation with your employee if you want to let them know. Is there a lot of paperwork for employees to fill out? Only, I mean, the carer's passport is probably, if you were to put that in place, is a bit of activity, I think, really, that you would have to maybe explore kind of the needs around it, but it probably helps in the long term to support that carer, so you're not having to do the same conversations over and over again. And one of the biggest things we found is that people felt like managers had quite inconsistent approaches. So say they said, oh, you know, I'm a carer, and they put some things in place to help that carer within that role. Say that line manager changes, because that often happens within big organizations. There's that kind of consistency there, and there's an agreement about changes that might needed to take place. Laura said, is this something that can be used for a short-term basis, or is it? No, it's short-term basis or long-term carers, so there's no differentiation between short-term and long-term. In fact, sometimes being a short-term carer can be so intense, it can be so difficult, because you might be caring for somebody maybe at the end of life. It may well be, you know, that crisis situation that you are caring for somebody on a short-term basis. So no, there's no differentiation. I think we have to be clear around that there's, you know, sometimes a short-term caring role can be very intense, just as a long-term caring role as well. Yeah. Brilliant. Thank you so much for questions. And as I say, we've both put our contact information on there. So if anybody is interested, they can get in touch with us. If anybody is interested in improving their approach, or maybe wants a session doing around care awareness, then we're more than happy to do that. There is the care awareness tool that people can use, and yeah, that's it. And all those tools should be available to you as well. So yeah, if anybody needs any support with it, we're here. We are Coventry based, aren't we, Anna? But there is support within Warwickshire. I'm part of a regional West Midlands group as well, and we know that there's a huge amount of kind of carer organisations across the area.